Hello, Dr. Varalakshmi. Thank you so much for being a part of my podcast, Ayurvedic Healing and Beyond. And I'm so happy to have you for the second time. And the first episode that I did with you regarding the concept of irritable bowel syndrome, I got such excellent feedback. All the listeners who have not heard that episode of Dr. Varalakshmi regarding IBS and irritable bowel syndrome, please do listen to it. And now again, we have her. And today we are going to talk about one of the most common gut health issue, which is constipation. So, doctor, thank you so much for being part of this podcast again.
Thank you so much for having me, Dr. Vignesh. I had such a great time chatting with you last time, and this time as well. I'm so looking forward to our conversation about the most common and I think often not considered constipation. Most people think that it's not a part of health issue. It became so common that it's like one of those symptoms where you just take something like a simple Triphala or something over the counter laxative, and they forget about it. Like, so I think, yeah, it is a very important topic that we need to educate a lot of people. So yes, I'm so glad to be
I
here.
completely agree with you. I mean, people are not openly talking about it. When people come and ask me, what do you do? So, when I say I'm an Ayurvedic doctor, so what exactly do you do? Sometimes I give a weird answer to them. We help people to develop proper toilet training. Because that's actually what we do, because once the toilet training is proper, many of their problems are solved. So,
Absolutely.
Doctor, let us get into the topic. Now, let us talk about constipation, and also let us talk about the Ayurvedic approach of this concept of constipation.
Absolutely. So, constipation is defined as a condition where a person will have trouble to open their bowel movements. That is one thing. So, if a person is going less than, say, 2 to 3 times in a 7 day, like in a week, then it is considered as constipation. And also, if a person has trouble to, while they are actually going opening up their bowels, but they still have any kind of pain or strain. Even like the stool is very, very hard that they have to spend lot of time sitting there. Even that is also considered as a symptom, one of the symptom of constipation. Also associated symptoms we can see like having bloating,
Mhm,
distinction of abdomen. Some people also experience pain while they're opening up their bowels as well.
mhm.
So these are the common symptoms we see in constipation. And as per Ayurveda, there is a concept called Vibandha. I think you also know about this. So Vibandha and Vata is the main Apana Vata, which is a type of Vata, is responsible for our elimination and defecation in our body. And if you are indulging in activities which can increase this specific type of vata, or in general vata increasing activities, even the foods which increase vata on a day to day basis, then that could lead to constipation or vibandha in Ayurveda.
Mhm.
So I think, yeah, that is the basic definition as per modern and as well as in Ayurveda.
So here, I mean, when I do consultation and when I get the patient's medical history, sometimes they themselves come with a self-diagnosis, "Oh, doctor, I'm suffering from constipation." So when I ask them, "So how do you know it is constipation?" And when I ask them, "Do you go to toilet every day?" They say, "Yes, I go to toilet every day, but I'm just not satisfied going to the toilet." So how can we tell them if that is constipation or not? Would you consider that as a constipation?
Yes, so that is such an excellent point, Dr. Vignesh. It's so true that often in my experience as well, people come that, I open up my bowels 2 times a day, but still I feel like something is actually in there, and, incomplete evacuation. So, yes, that is also one of the symptom. Very good point, actually. But we have to look at all the other things as well. Sometimes it might be to do with IBS as well. In a
Hmm.
irritable bowel syndrome as well, we can see the same symptom where a person goes to the toilet and they have this bloating and distension of abdomen,
Hmm.
but they say that, oh, I always feel like something is still stuck there. I want to just go and sit there for like 20 minutes, but I still don't feel like some everything came out. So I would say we have to look at all the other signs, like whether the stool is, hard, or they have any pain, especially while going to toilet. And I think also the frequency of bowel movement,
Hmm.
at least once a day as per Ayurveda, ideally in the morning, without you putting any pressure on your body. As soon as you wake up, you should be able to just go toilet, do the bowel movement. That is what we study as a normal thing in Ayurveda,
Exactly.
right?
That definition of what a normal healthy bowel. This is so important. I hope people understand this.
Yes, absolutely. So few things that make it normal, or like you doing it as normal part of how you get a sneeze, right? You just sneeze it. You don't
Exactly.
have to put any pressure, or it's a very natural, smooth process. So similarly, as soon as you wake up or any time during the day, because toilet, going to bowels or opening up your bowels is also a part of, like, from the childhood you have a certain nature to go at specific time. So if a person has a specific time during the day and they are doing it every day without any pressure or without any force externally, then that is one sign to say that okay, they have a normal bowel movement. And again, sitting on and not spending too much time.
Hmm.
Also, time is also very important. More than 15 to 20 minutes if a person is spending in the bowl in the toilet, then that could indicate that they have some form of a trouble, and they are not able to completely empty their bowels. That is
Hmm.
also another important sign. And like you said earlier, feeling of lighter, like
Hmm.
after you empty your bowel movements, you should be able to feel like lighter. Oh, I feel lighter. And also feeling like hungry. Yeah, I want to eat something.
Hmm.
I think these are the basic signs to say that they have a normal bowel movement. Also, we talk about like the stool consistency and other stuff, but I think to do with the habit and for a person to identify, these are the basic things.
Fantastic. Thank you so much for making it so simpler to understand. So I'm sure many people listening to this will understand. Or this is where I have to really differentiate if this is constipation or something not something related with constipation. So, doctor, coming to another aspect now, when we go deeper into this concept, now some people say, okay, they have this dosha analysis from the internet, and they take this concept and they say, oh, I have constipation, so I am vata. And now they come to a judgment that for the rest of my life, I'm going to deal with constipation. And sometimes they say that, okay, I am having constipation for ages. My mother had it, my grandmother had it. So there is no way I can come out of it. This is something that I have to live with it. Now, is there something like constipation is genetic and it is a judgment for the rest of their life? Can they come out of that?
Yes, so I think this is another beautiful example, Dr. Vignesh. I think one, there are two things wrong with this thing where we nowadays have lot of information, and it is not just finding information, but it's overload of all the information that we are exposed as a generation, which is leading to the misdiagnosis first case, I would say. Because if you go to a qualified Ayurvedic doctor like yourself or myself, we can actually identify them, saying that if it is actually a vata influenced type of constipation or not. So which is the first thing I would say. But even after that, answering the second question, um, there are several things that when we consider like a disease to be asadhya
Mhm.
is the type of disease which means that we cannot have a cure. There
Exactly.
is only management that we can do up to some extent, but
Lost
we
case,
cannot
gone case.
possibly, yeah, so lost cause, or you can say. So what I would say is we need to look at the age of that person. Genetic predisposition is important, but if a person is young and they're eating warm, unctuous, which are like the opposite qualities of vata dosha, which are like lagu, ruksha, khara, sukshma, chalan, right? So
Mhm.
if we are eating warm, unctuous food which has a little bit of fat, also like cooked in fat or has a bit of fat and has moisture in it, and drinking enough water, like hydration. They are doing proper hydration and they are having good exercise, because exercise is also another important factor which helps us to open up our bowel movements.
Mhm.
And not indulging in too much vata activities. If a person can actually change these basic components of their diet and lifestyle, along with the help of external Ayurvedic medicines, which are like Anulomana, like Haritaki is a very good Vata Anulomana herb, which is very simple and easily available. So there are also even more good herbs like Avipattikara, Swadhisthana, Virechana. So also there are, even for chronic constipation, there are more specialized Ayurvedic preparations, right?
Mhm.
So along with this, and even in a person going through extreme constipation or chronic constipation, we can do like Vasti,
Mhm.
oil Vastis or Anvasan Vasti, which can also help. So I would
Fantastic.
say,
Yes. Mhm.
yeah, so I would say before we saying that a disease is asaj or incurable, there are factors that we take into consideration, right?
Mhm.
So it depends on that. And yes, there are cases where, uh, for example, like certain diseases like Parkinson disease, where a person is old age and they are on this specific medication, which makes them body over the period of years together taking that medication, colon has lost its ability to function. For
Exactly.
them,
Mhm.
yes, it is incurable. For a young person, even though they have genetic predisposition, there is still a chance that we can cure constipation.
That is so true. I mean, in my experience, what I have observed, doctor, when people come and say, "Oh, I have been suffering from constipation for a very long time," what they're saying is they have come to a mindset. This is something that they have to live with it. And the worst thing that they can do is once they have that mindset is go through the dosha analysis question, because that tells them now you have all the reasons why you should believe in the belief that you have it. In many people, when you ask them, so how do you deal with constipation, sometimes they take Triphala, sometimes they take laxative, and in fact it's laxative abuse, and sometimes they don't go to toilet for like a week or even 10 days. I know one uh, flight steward, I mean air hostess, she goes to toilet like once in 10 or 12 days.
Oh
And
my
when you
God.
when you go into details, how do you deal with that, and she tells me the problem is not constipation. The problem is she has fear of using a public toilet. And
Oh my.
because of that, she's worried, okay, go using a public toilet, it's so unhygienic, and how can I go and sit there? So she trained herself, no, I should not go to public toilet. And then what happens is when she has the urge, she has access only to public toilet. And when she has a toilet that which she can trust, which is exclusive to her, at that time urge does not come. So this inability to have that proper toilet training with the routine, that spoiled everything. And the fact that she's a flight, she lives in the flight, goes to different time zone. So this, the concept in asatmi indriyartha samyoga correctly, and the concept of parinamam, the different time zones and all of this come in together, and this doesn't work. So then my work was, I told her this is something that can be easily be reversed. This is not an irreversible disease. You don't have to depend on laxative. And sometimes they say that, oh doctor, when I'm not able to go to toilet, sometimes I just smoke a cigarette and then I feel light, and then I empty my bowels. And the worst case scenario, even with a cigarette, it doesn't work. So maybe I need to have a cappuccino and then a cigarette, and then only it works. These are the kind of laxatives that they use. So I feel calling constipation a genetic problem is a half truth. That if they did a dosha analysis, please do remember this is something completely reversible, and that can completely change with so many change with your diet, change with your routine, change with your lifestyle, change with your mindset. All of this put together. Now, doctor, I want your experience. So, how do you help with the lifestyle changes? And then we will go into the medications. Now, you told me about one thing that I really want to come back to you about is the matravasti or anuvasanavasti, which is, we call it as the oil enema that we do in Ayurveda. That I will come to it. But what are the lifestyle changes that you recommend to people who are suffering from constipation?
So I think your example perfectly, defines all the things that we do, like having
Mhm,
constipation and then going on cigarette and then like smoking, which is like
mhm,
nicotine, and then
mhm.
caffeine. So
Exactly.
both of them are again not a good kind of things that you want to put into your body. You are
Mm,
already
mm, mm,
having a
mm.
health disease or condition, and then on top of it doing these things, like you will, the more you put that into your mindset saying that, oh, nicotine helps me to go toilet or caffeine helps me to go toilet, then it becomes a bad habit associated with a result.
Mhm,
So
mhm.
which is not a very good thing, to be honest. And coming to your question, lifestyle, one of the important factor that plays a huge role is to understand their body basically, because often there are a lot of things which come into play when we look at a condition like constipation. One is to do a proper exercise, but there is also other factor where, like athletes or people who are very health conscious, health pro we can call them,
Mhm, mhm.
they engage in excessive exercise to the point where there is dehydration or there is excess vata imbalance in their body. So finding that balance where it is not causing excessively vata imbalance or aggravation, and also at the same time it is creating that movement and helps your colon to get stimulated. One thing I would really emphasize upon. And other factors like sipping simply warm water. I see this habit where even with this COVID situation, there are a lot of people who went on and did this kashayas,
Mhm,
like excessive consumption of certain spices. It's good. I'm not saying Ayurvedic spices are bad or anything, but the fact that they have like 10 different 15 spices in that kashaya and every day they went on drinking it.
mhm,
This
mhm,
kashaya for a person who is healthy and all may not cause any kind of imbalance, but for an unhealthy person or for underlying health conditions, it can cause imbalance. Same
mhm,
goes with this use of medicine, like just going and buying something like Triphala or things like that. So I think I got a bit diverted. But in exercise is one thing, and then keeping hydration and also not like ice cold drinks or
mhm.
things
Frozen
which
food.
are like, yeah. So going for warm water, which always stimulates our Agni and helps us to, clear that Sroto Avaroda in our channels. That is one thing I always tell them, to sip the water. And drinking excessive water.
Mm,
I think modern nutrition recommends us to have like 3 to 4 liters or 2 to 3 liters per day. But as per Ayurveda, Ayurveda recommends us to drink when we feel thirsty, not
mm,
when you like just like overload of anything. That is another thing. And another important factor, like the example of that hostess, air hostess, uh, Vega,
Avaroda, suppressing your
yeah, Vega,
natural
Vega. Yeah,
urges.
suppressing your natural urges, especially to open when you feel like going bowel movement. Even in lot of my clients as well, I see the same thing where they are in a work or something, or they have a meeting, then they'll stop that bowel movement. And then after over a period of time, your body will stop actually giving you even that stimulus, like, you need to open up your bowel movements. The whole physiology has been adapted to say that, yeah, because you are stopping me these many times, then the nervous stimulus and that sensory function has completely, pattern has changed, right?
Mhm,
So I think these are important factors for people to consider when they are having a condition, even with IBS kind of, any kind of digestion. It's important to eat on when you feel hungry, and then open up your bowels when you have that urge, and not to disrupt that natural cycle or flow. And another thing is training your body to go on specific time. Like
mhm,
for some people, they wake up, as soon as they wake up, they want to go to the toilet, and it comes very easily because you trained it in such a way. So if someone is looking to help with their, or manage this constipation, one thing is to train your body or to have that bowel movement at a specific time.
mhm.
Then over the period of time, initially it is difficult, but once you train your body, it is, our body is very much what you call intelligent
Receptive,
enough to,
receptive.
yeah,
Yes,
to
exactly.
adapt. So I think these are the things I would say when it comes to lifestyle. One has to be conscious to change if they want to manage a condition like constipation.
I think even their eating time, once they have a routine with their
Yes,
timing of eating, I think that also brings in routine with the elimination. Sometimes,
absolutely.
people say that, eating on time, at the same time, you are hungry on time. And then when you eat on time, that makes your bowel movements also regular.
Yes, I think paying attention, one thing, another thing we always, Ayurvedic doctors always recommend is to eat mindfully, right? So
Hmm.
when we are eating mindfully, and I educate my clients saying that if you are eating a food which doesn't necessarily require you to use a spoon or something, if you use your hands, that is such a stimulation, because when we engage all the five senses with the food that we are eating, it stimulates all the gastric juices, and it also stimulates the good kind of hormones and digestive enzymes, and helps us to digest it better. There
Exactly.
are certain foods where we definitely need to use a spoon, like noodles or something like
Hmm.
pasta. But when you are eating food, always try to engage the five senses, looking at the food and smelling the food, touching the food. All these are very good techniques to improve our digestion.
That's so true. And one thing, when I tell people suffering with a long-term constipation, one of the biggest problems that they suffer with is anxiety. Now, why I say, they come and say, "Doctor, I have not gone to toilet for last few days, and now this is making me worried." And okay, especially when they come to my retreat, where coffee is not allowed and smoking is not allowed, and they say that I can't smoke, I can't drink coffee, and now I'm not able to go to toilet. So how do I deal with this? I tell them, don't worry, it will go out any day. It's not going to be stuck there for the rest of your life. It has to go out. Now, get it out of your mind that, I have to go right now. You're not going to be stuck somewhere in the forest, and now you have worried that, will I be able to go to toilet right now? You have the toilet access right now. So first thing is, when they want to recover from constipation, I tell them, you need to give yourself at least 1 month's time to train your bowel movements. It's not going to happen like a switch. Okay, now I'm
Yes.
going to change that. Now, once they realize it takes about 1 month to have a proper bowel training, that also gives them, okay, now I have to be patient. I have to train myself. And along with that, changing their routine, and then changing the diet, and then avoiding cold foods, and then the frozen foods that, like you said, all of this, when you put together, and then within 1 month, they see that, and now their bowels work like clockwork. you know that aspect that we have to bring in. So now, Dr. Leon, let's get into the concept of laxatives, and also I want to discuss about the laxative abuse. As a doctor, I'm sure you would have experienced so many patients coming up and telling, doctor, I'm taking Triphala every day, or I'm taking Senna, or I'm taking psyllium husk. These are common feedbacks you always get. So I want to know, who should use laxative, how often can they use, and who should not use laxative, and how do we know if somebody is abusing their system with laxatives?
So such an important topic that we need to actually emphasize upon, because most of the Ayurvedic herbs, and even like most of these over the counter laxatives are easily available for most, all of us. And it is all right, first of all, to use laxative, or at least if to say that Triphala, for a healthy person who is experiencing, let's say if we go to a party or somewhere, or for a couple of days, even for me, if I travel for a like continuously for 1 day or 2 days, then I do get constipated. So for me, because I'm fairly a healthy person, if I'm using Triphala, let's say for that occasional purposes, or even say I'm using Senna for that occasional purposes, it's all right. It's not going to cause a permanent damage or any kind of health issues for me, or it's not risky. But for a healthy person, even for a healthy or a person who is having constipation, if they're every day taking, say, Triphala for like 2 grams, or like 3 tablets or 2 tablets for say more than 6 months, then it can definitely have permanent health permanent damage, and also like risks, other kind of risk, maybe not to do with the constipation or digestion, but because Triphala is a medicine, right? We
Mhm.
consider, as per Ayurveda, if we are using even the even the dangerous thing, like we have a saying in Ayurveda, like if you know how to use even a poison, you
It's
can make
medicine.
it
Yes, medicine.
medicine.
Exactly.
But if you are not using the medicine in the proper form, then it can even turn into a dangerous thing. It can work like a poison. So this principle applies universally to anything that we are using,
Mhm.
including that very easily available Triphala to psyllium husk to senna. So we can apply that principle. So it's important to identify occasional usage of these things are okay for a healthy person or even for a constipated person, but we should not be focusing on them as the treatment or therapy, because constipation is not just a symptom where you're having a trouble with just a simple bowel movement, but it is coming internally from something bigger or
Mhm.
even more. So one has to work on their diet and lifestyle to manage the constipation or to cure it, not to completely focus on laxatives. And some of the side effects, so common side effects that I see in my practice include, with Triphala, they can end up with drying of their stools. So,
Mhm.
like, it can cause the drying of stools because Triphala is a very mild laxative. It is not a um, what do you call that, severe laxative. But even with that, if a person is using for a very long time, they can experience drying of their stools, and other problems like wind. Some people also complain they have headaches, and there is this severe case, a lady who says that she has like, for like, I think she used it for 4 months or 5 months, and she has palpitations in her heart.
Mhm.
So it's very important to understand, even though these herbs are completely safe for a person who doesn't have any health problems or so, but for a person who has underlying conditions or genetic predisposition of certain disorders, they could very well end up with a different kind of health problem instead
Mhm.
of getting rid of this health problem they have. And also there are senna, which is a kind of a moderate to severe laxative, we can call it. And even reported studies are there where senna has caused like problems to do with the people losing their nerve and as well as the function of their colon. So over a period of time,
Mhm.
because your body has stopped working normally, it's just
So
is.
when you say over a period of time, what is that over the period? If you could give a tentative period,
I
so
would
that
say
people
more than,
understand. Sometimes
yes,
listeners would
of
be thinking,
course.
"Oh my God, I'm taking Triphala or Sedna for over 2 3 years." So let's just understand what is this.
Yes, of course. Very good question. So I would say if a person is taking more than 6 months, and even like more than 6 months to 1 year, after 1 year or so, you will permanently lose the nerve function and the movement of your intestinal muscles. They
Hmm.
don't contract anymore unless you give this external factor, because the
Mhm.
body is adapted itself to wait for that external stimulus to come to react or work. But it is a
Mhm.
natural physiology for our intestine to contract, because you have been using this for such a long time. Body has adapted. And in my personal experience, I also see people doing colon cleanses, which is
Mhm.
a very common treatment, for like certain nutritionists. I'm not sure, some people very rarely recommend, but and what happens is that same thing goes away. This can cause electrolyte imbalance, like constantly you are dehydrating your body by externally using this colon cleanse. If you're doing more than 4 5 colon cleanses in a period of 2 months, then you could very well end up with dehydration, electrolyte imbalance, losing, like becoming more, even more chronic constipation. Again, the same factor that your body is stopped working, functioning normally, and is waiting for the external stimulus. So
Mhm.
I would say these are some things. And also like stomach pain, distension of abdomen, IBS. I also see this, headaches, migraine, these kind of other kind of side effects and complications people can develop if they use too much of
Laxative,
or
laxative.
dependent on laxatives.
It's quite interesting when people are having chronic constipation. These are the same problems that are associated with this, and people are having laxative abuse. This is again the same problem that they are suffering. Now, it's interesting you brought up this concept of colon cleansing. Once there was a lady, she was addicted to this concept called as coffee enema. And so I used to do coffee enema. Oh, it's fantastic. I feel so good after that. And if she doesn't do it, she's constipated. So wherever she travels, she goes with this coffee enema kit. And I was just looking at it. Coffee enema, it's so drying up. As you said, when you talk about vata kopa, when vata is increasing, it's a concept that too much of dryness is happening. And in fact,
Yes,
constipation is an issue because of dryness in your gut.
dryness and pollen. Yeah.
And that is why in Ayurveda, all the enemas, be it the oil enema, even the decoction enema, has an oil medium as the base. Because if you don't give the oil medium, it can completely rupture that gut microbiome there.
Absolutely. Yeah.
So that is why oil enema is such a powerful method to recover from a chronic constipation. Sometimes when people say that they don't go to toilet like in 3 or 4 days, we just put them on a oil enema for like 1 week every day for like one session for 1 week, and after that it works like clockwork. And of course, provided they are also getting back to good routine.
Yes.
So this oiliness, the concept of what dries their gut and what does not, this basic understanding is so important. And when you spoke about this dryness of stool when they consume Triphala, once I was meeting with one of my friend. He is a gastroenterologist, and he does a lot of surgeries. He takes the intestine out once he cuts open the abdomen. And once he was telling, your Ayurvedic medicines are giving me a lot of trouble. What do you mean by saying that? Once I took the this thing, and he was taking Triphala every day, and you could see the powder in the intestines
Oh my God.
because he was having such a overconsumption of Triphala just to empty the stomach. So, like you said, because of this laxative abuse, the natural bowel movement, the intelligence of the body is lost. It has completely paralyzed. So people need to understand that laxatives are something you can take it very, very occasionally, like once or twice or maybe 3 times, when you travel and you don't have it, or when you're having this. But if it is more happening regularly, and if you're, depending on laxatives every night, then you definitely need a lifestyle change and need a proper guidance from an Ayurvedic professional or somebody who can help you come out of this constipation. But
Absolutely. I couldn't agree more actually.
Mhm.
Um, there are two things, which is because this, if you look at the modern concept of understanding this constipation, why Ayurveda is so progressive when it comes to these concepts. I have these clients who say that even nowadays we see a lot of this salads are good. I'm not saying they're bad because it's made up of fiber, and there is raw juices now. This is a pattern: vegetable juicing and then fruit juicing, or like in the form of smoothies. So when it comes to Ayurveda, we look at everything on the quality, like gunas, how it affects our body and what kind of functional aspect it's going to affect afterwards, after we
Mhm.
are eating certain food. But this concept is not still it's not there in the modern nutrition, or most modern doctors, their understanding physiology of food and its effects on our body is different.
Mhm.
With this upcoming trends like raw juicing and then smoothies, cold,
Mhm.
especially the ice
Mhm.
cold smoothies, there are clients who come to me who will say that, because I thought that someone told me that, or my some nutritionist, or I read this article which says that I can, I have drank this raw juicing. If you do this juicing for every day on empty stomach, they wake up and they drink like wheatgrass powder or other things like moringa juices, you name it, everything. They are all super healthy foods. I'm not saying they're bad foods or anything, but the way we are consuming it, if you are every day on empty stomach, when you have low agni in the morning, like your metabolism is very, very low in the morning, and they wake up and they drink these juices. They say, for the first 1 week, I'm fine. I have very good bowel movement. But now I feel like I can't sleep at night. I'm having these bad migraines and I feel like very tired in the afternoon. So when I tell them that, because once you have, you noticed this pattern where once you
Mhm.
started this raw juicing is when you started to have these headaches, they'll be like, oh yes, I think so. I started to feel like weak and I got this migraines. Then slowly I tell them that it's good that you want to include all this amazing fiber content and everything, but end of the day, if your body is not able to absorb any nutrient from it, and it is causing other problems like drying of your colon and causing you headaches, there is no point, right? No matter how healthy organic food we want to eat, if you are not able to digest it and get that nutrient,
Mhm.
there is no point. So
Exactly.
once I educate them to have warm foods and take it in a different form, because for years, I think for ages, humans are eating vegetables while cooking. After cook, you
Exactly.
eat something, right?
Exactly.
So I think this is where we need more education and emphasis, because something is super trendy or super
Mhm.
health
Mhm.
craze, it may not suit everybody.
You know,
Also, we not overdo it.
mhm.
Overdoing something can always have some problem end of the day.
Exactly. I think once, as you were saying about this raw food, and humans for ages, they have been cooking and eating. Once I was having a discussion with a person who was an advocate of raw food, and he was saying that cooking food is so artificial, because if humans needed to cook food, then stomach would come with a cooker, because nature would have designed our stomach with a cooker. So I was like, that's interesting, but I do appreciate his way of thinking, because it makes some sense. Why is our stomach not there? That kind of thing. But you have to understand, our stomach, who I mean, the people who used to eat raw food are people who are living in a primal nature. They run, they move. Their agni
Yes.
is, their metabolism is like beyond.
Like a pita person.
Exactly, it is beyond your your scope of thinking in today's Kali Yuga. Where
Modern.
you're
Yes.
sitting most of the time and you are living in Zoom today, and your movement is half restricted. And today, because our movement and metabolism is weak, this raw food is fantastic for a person who has a fantastic digestion and absorption and metabolism. But for a person who is suffering with constipation, who's suffering with bloating, who's suffering with acidity, who feels heavy after food, if they consume raw food, it's only going to make it worse. This is my observation in many of the people who come and tell me that I turned vegan and they became more tired. And I feel the problem is they went cold turkey. Immediately, they went to the other side without taking the proper measures.
Time transition.
Exactly, exactly. So I think we
I
need to educate them to understand there is a step by step. Don't immediately go and run a marathon. First, start by walking, and then, make sure your diet is changed, your sleep is good, and then maybe you can run 1 kilometer, and then you can try for a marathon. This way, we have to approach them.
absolutely agree. I think I do see people who are absolutely fine. On the other
Mhm,
spectrum, like you said, if a person has this good metabolism to the point, like if a person is highly a pitta dominant prakriti, then
mhm,
for them, they don't see any problem. I
mhm.
do get clients who saying that, why are you telling me raw food is bad or don't do it? But I find it perfectly fine. I feel more energetic after doing this juice and all that. Then I tell them that you are blessed with agni, you're so great. But not everybody can actually take that raw juice or cold smoothie and survive.
Exactly.
It's different, right, for a person, because 80% of the people nowadays, you said, because of our what we call that lifestyle, where we are sitting at home or doing very less compared to that our old age men when they were doing hunting and all these excessive physical activities where metabolism is super high. We don't have that, and movement is also not there. So it's important for us to acknowledge. And also, like you said, we can still enjoy these raw foods. Like I recommend them to do it during spring or summer when there is a good amount of sunlight is there and there is a chance of them moving more, and all. That would be a ideal time if they
Mhm.
are really really interested to do this juicing and smoothies and stuff. So
Exactly.
yeah.
I think going, some people, what they do is they indulge in an unhealthy lifestyle and suddenly they decide, okay, now I'm going for a juice detox. I tell them, please don't go cold turkey, don't go to the other extreme. Instead of going for an extreme detox, just try to stop putting unhealthy stuff inside your body. That itself is will help you to a great extent. And then maybe, in a protective environment, when you're able to do a detox therapy, that will work best. I think that's the same approach with, people either go for a laxative abuse or they try to change many things and they are not able to have a middle path. This middle path is so important, which is what Ayurveda advocates.
Moderation, everything
Exactly.
in moderation.
So,
Absolutely.
so doctor, so what would be the key takeaways for that you would, advise people suffering with constipation, if we have to sum up this discussion?
Yes, I think one thing I would say is try to develop this conscious relationship, because that goes for all the diseases out there, and for especially for constipation, very very important thing is to not hold that urge to pass the bowel moment. So that is, in my experience, once I educate a client that don't worry about like if the toilet is going to be like in your case,
Hmm.
example where she's so worried that, oh, the public toilet is not safe or something, I recommend them like just carry some wet wipes, antibacterial wipes or something with you if you
Fantastic.
have
Yes.
a job. So it's a very simple modification, but at least you can use that. And if you still open up your bowel movement, then that becomes a habit, and slowly they have to train and
Mm.
to have a patience. Because I see people saying that, oh, I want to do this consultation now, can you give me appointment like tomorrow please, I want to become so healthy version of myself, give me an appointment tomorrow. But I tell them that I don't have a time or something, and I tell them that wait. And also same thing goes with the result as well. Like they will ask me, okay, if I take this medicine, will I see change in like 1 week, will I feel better in 2 weeks? Then I tell them that you have to imagine your body as something, like a wall. If you have a wall in your house over the years, then it has this moisture, slow
Mhm.
moisture. Every year you are just painting on top of that moisture,
Mhm.
and one year you want to go back and say, if you open that, the whole wall is spoiled now. You
Mhm.
cannot repair it in 1 hour or 2 hour. You have to completely remove the board, do step by step procedure, right? So same
Exactly.
thing for the disease as well. So we have to work with our body, be patient with it. It will take time. As long as we are consistent, we will definitely be able to cure most of these modern day, diseases.
Issues, yes.
So yeah, I think, yeah, be patient
Thank you so
with
much.
your body.
I think that's so important. I think the reason why patients are patients is because they don't have patience. There's another saying.
Oh wow, that's a very funny.
Because they want to come out of it as soon as possible. They can't deal with it. That's another thing.
Yes. It
And
becomes
as
so
a
anxious,
exactly,
keeping hold of that mental constipation, you can call
exactly.
it. So
Like you said, the mental constipation, sometimes people are holding on to their past patterns so long, holding on to the past unhealthy memory so long, they're not able to let go also. And there is a
yes.
funny thing, the antidote for stress is to relax. And if you dissect the word relax, lax is a laxative for constipation. So it's
Yeah.
to let go.
Absolutely, I think so. It is about rewiring not only just your body, but rewiring your mind as
Mind,
well, right?
exactly, exactly.
we store so much of this over the years, like,
Exactly.
layers and layers. We have to work it from the top
Bottom
layer
up.
and go to the bottom layer. So yeah.
So thank you, Dr. Varalakshmi. So how can people reach out to you? Do you do online sessions, and how can people find more resources that you put up? By the way, I love the Instagram contents that you put up. It's fantastic. Every time the reels that you put, it's so simplistic, easy to understand. You demystify the whole concept of Ayurveda. And every listener, please do follow Dr. Varalakshmi, and I'll be putting all her details in show notes. At the same time, could you tell me how people can reach out to you, Doctor?
Yes, of course. Like Dr. Vignesh was saying, I have a Instagram handle, which is absolutely my name, at the rate Dr. Varalakshmi. So you can just message me, and there is a lot of information on there. Simple things that you can do about Ayurveda and how you can become a healthier version of yourself. And, yeah,
Yes.
thank you so much for having me, Dr. Vignesh. And also, thank you so much for listening, everyone.
Thank you, Doctor. And I look forward to having more sessions and this insightful discussions more with you. Thank you so much.
Thank you so much, Dr. Vignesh.